Hi, Dr. Howard. Do you mind if I run a case by you?
Sure, absolutely.
All right, so we have a 45-year-old woman out there, Mrs. Smith.
Oh, come in.
Hi, sorry to interrupt. I just have Mrs. Smith's vital signs.
Oh, perfect.
Okay, so her blood pressure was 120/76, temperature 96.8, her pulse was 64, respirations 14. She was 5'5" and 170 pounds and oxygen 98.
Great. Thank you so much.
Great, thank
Appreciate
you.
it. So like I was saying, we have Mrs. Smith in the other room, 45-year-old female with a past medical history of hypothyroidism. She presents today with 12 hours of acute onset left-sided facial drooping.
Okay.
Her daughter says that it happened sometime last night around dinner time.
12 hours. I wonder why they waited so long to come in.
I know, I was wondering the same thing. But it hasn't improved and it hasn't gotten worse over the last 12 hours. I did a physical exam and her neuromuscular exam is intact. It's just cranial nerve 7 that's affected. So, I'm kind of running differentials in my head right now.
Yeah, what is it? What's on your differential?
So I'm thinking that she maybe has an idiopathic Bell's palsy or Lyme disease, and I think that we should also rule out herpes zoster.
Okay, do you know if her vaccines are up to date?
I don't know that.
Okay, all right, we can check that with her. And so any other focal neurodeficits?
No, so originally I was thinking it would be a stroke, but after doing her physical exam, it's just cranial nerve 7 that's affected. She is not able to crinkle her eyebrows, and she has absolutely no weakness, no headache, no altered mental status, and 5 out of 5 strength and sensory is intact bilaterally in all 4 extremities.
Okay, and any risk factors for stroke? Any smoking? Any history of clots in the past or anything?
No, she doesn't. Nope.
Okay.
And she, her vitals are stable. She's not hypertensive, and no family history of any kind of, stroke factors.
Okay, all right, that sounds good. You want to go meet the patient?
I would love to.
Okay.
Action.
Hi, Ms. Smith. My name's Dr. Howard. I'm working with Jordan today. She told me what's going on. So I just wanted to hear a little bit more from you. And who'd you bring with you today?
This is my daughter, Jane. She's actually the one that noticed it.
Jane, hi. Nice to meet you.
Hi, nice to meet you.
So can you tell me what you noticed when this started last night?
Okay, so we were eating dinner around 8 to 9, and I just noticed that the left side of her face looks a little bit off. Like, it was very strange. She was only chewing out of the right side of her mouth. I don't think she even noticed it, but it wasn't usual.
Yeah.
And I kind of wanted her to go have it checked out immediately, but she didn't want to at the time.
Yeah, why didn't you go last night? Why'd you wait till this morning?
Well, I just started a new job and I don't really have health insurance that kicked in yet.
Okay.
And I don't have a car, so I had to wait till the morning because the public transportation wasn't working.
Okay, I see, I understand. All right.
So I made an appointment with you guys first thing in the morning.
Okay, good. Well, I'm glad you came in this morning. So Jordan here is going to tell you a little bit what she thinks is going on, and I agree with her plan.
So what we think is going on is what's called Bell's palsy, and Bell's palsy is a weakness of cranial nerve 7. It's a nerve that innervates one side of your face, and so I know that you had said that you were pretty worried about it. I'm sure because it looks like a stroke, right?
Yes, that's what came up when I Googled it.
Right, exactly, and that's completely understandable, and it's really hard to distinguish sometimes, but what's really good about your case is that it might seem like it's a bad thing, but what's good about it is that you are unable to wrinkle your forehead. And when you're unable to wrinkle your forehead, that is more indicative of Bell's palsy. It means that it's just that one nerve that's involved. And since you don't have any kind of other weakness or headache, no confusion, I'm really not thinking that it's a stroke. But Bell's palsy, it can be caused by a couple different things. So most of the time it's idiopathic, which means that we don't really know where it comes from. But it could also be from Lyme disease. Are you from this area?
Yeah, I am.
Okay, so do you go hiking? Do you like to spend time outside?
Well, I do like to. It's been nice recently. So I have been hiking a little bit.
Okay, and I noticed when I did your physical exam, I didn't see any kind of rash or lesion on you.
Yeah, I haven't
but
noticed any either.
Right, but it is still completely possible that you have some sort of underlying Lyme disease that's causing this. You also, it could be a herpes zoster virus.
Oh yeah, and we did want to ask, right, are your vaccines up to date? Did you get all your childhood immunizations?
Yeah, I did.
You did, okay. So did you ever have the chicken pox when you were younger?
No.
You didn't have that, okay.
So like we said, most likely it isn't idiopathic Bell's palsy. It kind of comes out of nowhere, and you know, it's unfortunate, but the good thing is that usually it's self-limiting. It usually does resolve on its own. And what we're gonna do is we're gonna give you some medication to help, you know, mitigate the long-term symptoms. So we're actually gonna give you a prescription for prednisolone. I want you to take it 60 milligrams a day. It's gonna be 20 milligram pills 3 times a day. And that'll hopefully in the long run help with long-term side effects, but it won't actually speed up the recovery. But we're hoping that in 3 months it should be getting better.
Is that going to interact with my levothyroxine?
No, you're fine to take prednisolone with your levothyroxine. However, have you ever taken a steroid before?
No, I haven't.
Okay, so there are some side effects with it. I mean, you're only taking it for 7 days, so they shouldn't be too severe, but you can have some weight gain and some fluid retention. It can also make you a little anxious and jittery. But again, you're taking it only for 7 days, so none of these should be long-lasting symptoms. But if you do you have any drug allergies that you're aware of?
No.
No, okay. If you do ever become short of breath or feel like your throat is closing, tongue swelling, you have any rashes, new rashes or tingling, you should go to the emergency room immediately if you're having a reaction from it.
Okay.
Okay.
And also if you notice that you have any kind of new onset, headache, weakness, fatigue, confusion, I want you to also go to the emergency department for that.
Okay.
And one last thing is because you are unable to completely close that eye, I want to give you a prescription for eye drops to keep it lubricated because you are at risk of having a corneal injury. So we're going to get those for you, and then we're also going to prescribe an ointment for you to put in your eye at night. And we do recommend that you tape your eyes shut at night so that while you're sleeping you don't, you know, get dried out, don't have any kind of eye injury from that. Do you have any questions for us?
No, that was it. Thank you.
Okay, I think we actually have some samples of the eye drops back there. So I'm just gonna go get our medical assistant Sabrina to go get some, okay?
Awesome. Thank you.
All right, well, it was really nice meeting you.
Thank you.
Come in.
Hi, Mrs. Smith. I just have the eye drop samples that was for you.
Thank you. And how often do I take this?
So you can use them 4 times a day, and especially before you go to bed.
And you can, if you feel like you need it more than that, feel free to, you can take them on the hour, okay?
Okay.
I just
thank
want to
you.
make sure that we keep that eye lubricated. And do you have any questions for me?
Should I come back here to follow up?
No, so you should follow up with your PCP in about 2 weeks after you finish the course of your steroids, okay?
Okay.
Any other questions?
No, that was it. Thank you.
Okay, well, it was so nice to meet you.
Thank you.
Thank you.